Hello everyone. Welcome to the class of Patient Safety and Occupational Health. This week we are going to talk about the concept of patient-centered care in patient safety. I am Ms. Kinan. I'm presenting a material prepared by Ms. Ranova for this class. So many people tend to think that patient safety is solely about standard operating procedures or SOPs, patient identifications, or correct medications administration. However, a primary cause of patient safety incidents is the failure to involve the patient in the care process. Therefore, in this session, we will explore how nurses can establish truly patient-centered care, covering everything from communications, patient involvement, and practical nursing implementations to respecting patient cultural diversity. Before we dive into the material, let's look at our learning objectives for today. The goal of this class isn't just for you to memorize the definitions of patient-centered care, but for you also to be able to answer the simple questions such as, if I were to become a nurse tomorrow, how would I apply patient-centered care to my patients? In another word, every concept we study must be applicable in the clinical practice. So we will then be covering the topic of concept of PCC or patient-centered care, then how we do involve the patient itself and then the family regarding the patient safety. We then also will talk about how we explain about patient-centered communications and how we implement PCC concept and nursing practice, as well as how then we also apply PCC in the context of patients with cultural diversity. Now, let me ask you to take a moment to see these slides, the image of a case. So we have Mr. Andy, who is 65 years old, and he was admitted due to heart failure. And then during the hospitalization, the nurse explained the medication using medical terms. The patient nodded and never asked questions, and then the family also was not involved during the educations. And once Mr. Andy being discharged, the patient only received a prescription without further explanations about the diet, fluid restriction, activity, or any warning signs. In the result, 4 days later, the patient returned to the emergency department with worsening shortness of breath. So this, if you can see, during the hospitalization, nurses were talking using medical terms. There's no idea from the patient as well as the family. And then at the chart, nurses just dispose the medications without explanations about diet, fluid, activity, and warning sign. And then it then leads to the patient being readmitted through emergency department. Now, my question to you is, what do you think is the primary cause of this incident? Could it be A, misdiagnosis, B, medication error, C, lack of communications and patient engagement, or D, lack of medical equipment? And then most of you, I think, will be thinking about medical error as the answer of this question. But then your answer isn't wrong, but I want you to think about deeply and reanalyze the situations. Let's look at it again. Why did actually the patient take the wrong medication? I think because the patient did not receive the proper understanding how he then will be the in charge for his therapy at home. And why didn't the patient understand? I think because here, if we see again the patient, they don't have or they don't receive effective communication from the nurse, where then there is the breakdown of communication because the patient here is not being involved in the care as well as the family. So this is the essence of patient-centered care. Many patients' safety incidents do not actually stem from the technical errors, but rather from the lack of partnership that happen between healthcare professionals, the patient, and their family. Now, let's take a look on the definitions of patient-centered care and why patient-centered care is very important. So, in the early stages of healthcare development, a success of care was largely measured by the ability of healthcare professionals to treat illnesses. The primary focus was the disease itself, so we call it disease-centered care. And as the health sciences evolved, the paradigm shifted to provider-centered care, where healthcare professionals were the central decision makers. Although the quality of care improved, but the patients often still played a passive role. And today, healthcare has shifted towards what we call patient centered care or PCC, an approach that we position the patients as an active partner throughout the entire care processes. Patients do not merely receive treatments, but they also involve in decision making based on their needs, values, preferences, and life goals. The WHO subsequently developed a broader concept known as people-centered care. This approach focuses not only on the patient during illness but also consider their family, community, and the continuity of healthcare services. Why is this shift important? Because various reports indicate that many patient safety incidents are not actually caused by the lack of knowledge among the healthcare professionals, but rather by the ineffective communication, poor coordination, and the failure to involve patients in the care processes. Now, let's analyze this briefly. In your opinion, does a scenario where a patient simply follows all instructions from healthcare professionals without understanding their own condition constitute patient-centered care? Okay, let's discuss the aspect of PCC one by one, right? So if you can see here, we have like 1 in 10 patients experience harm while receiving health care, and then actually why the incident happened, we can prevent it by better communication. We involve the patient so that the patient who are then the major contributors for the patient safety incident will be helping us in not making the incidents. So as we talked about previously, we see the shifting of paradigm in care from disease-centered care to provider-centered care to patient-centered care, and now recently to people-centered care. So it's not longer only the patient, but also the community where the family also involved. So if the patient, let's think about the briefly scenario that in our opinion, if the patients just completely listen to whatever we were saying, do you think it's patient-centered care or is it more to provider-centered care? I think if we do not involve the patient, then we are probably still here where we are in charge, we take control of everything, and the patients did not have the ability to play the part in their care. Now, let's move to the definition of patient-centered care. So, the students often mistakenly believe that the patient-centered care means that the patient is the king, but that is not quite accurate because the patient-centered care is actually an approach to healthcare that places patients at the center of the entire care processes by respecting their needs, their values, their preferences, and their choices, and involving the patients and their family as partners in decision making. So here we can see we have the patient and then we have their family. We respect their decision, we open the communication, we build partnership with them, we then share information about their care, and then together we work to have the decision according to the needs of the patient. So it's from the patient-centered care that we can increase the patient satisfaction, which then increase the patient safety, that will then increase the quality of care that being given. So actually in patient-centered care, it doesn't mean that every single wish of the patient must be granted. Instead, the healthcare professionals must respect the patient as a human being with rights, values, beliefs, life goals, and preferences regarding the care they receive. For instance, a patient might choose a specific therapy after understanding its benefit and risk. The healthcare professional's role is not to coerce the patient, but to provide accurate information so that the patient can make an informed decision, or what we call here shared decision making. And with this approach, we hope that the patient is no longer merely an object of care, but a partner. So nurses continue to rely on the scientific knowledge and evidence, but the decisions are reached through communication and collaboration between the patients and their family. This is why patient-centered care is such a crucial dimension now of healthcare quality. So let's take a look on the example that I have here at the hospital. So one diabetic patient told us, I cannot managing injecting insulin 4 times a day because I work in the field. So as nurses, what should we do? Should we say, oh, you just simply follow the doctor's instruction? Or should we say, let's discuss the treatment options that the best suit your situation? So when we try to discuss to meet the needs of the patient, their values, preferences, and choices, we are actually having patient-centered care. One more example. So we have an elderly patient who wants their child to listen to the explanation about medications before discharge. So as nurses, we then allow the family to participate in the education session. We also explain things in simple language. We ensure that both the patient and the family understand what is the medication, the therapy after discharge. While we try to include the patient and the family, it means that we are applying the patient-centered care. So based on the previous explanation, what do you think? Are patients allowed to refuse medical procedures, or we should then ask them to just do whatever procedures that's right for them? Actually, patient still have the right to accept or to refuse medical procedures after receiving adequate information. So that's why we have within the hospital what we call informed consent and informed refusal. So as nurses, our role here are to ensure that the patient understand the benefits, the risks, the alternative, and then also we have to be respectful for their decision according to the ethical and legal standard when they then finally decided on what they want to do as the goal of their care. Because again, it's a patient-centered care. We then see the patient in the center with all the needs, values, preferences, and choices. Then we make a decision according to that. Now, let's see the principles of patient-centered care. So there are four main principles: dignity and respect, information sharing, participations, and collaboration. So as patient, we then respect their choices. We perform, we do, we try to build participation, we build collaborations, as well as we been sharing information. So actually the goal of patient-centered care is to deliver safe and high quality care that is respectful, um, responsive, and aligned with what matters most to the patients and their family. Now, let's discuss about the principle one by one. So, patient-centered care is more than just a slogan. For care to be truly patient-centered, there are four key principles that we must apply. So, let's discuss them by one. Dignity and respect. So this is what we always encountered in our daily nursing life. The principle is that we respecting the patient's dignity. As nurses, we must understand that every patient comes from a different background, whether in terms of culture, religion, education, age, or life experiences. Therefore, care must not be uniform. It must take individual needs into account. For instance, a patient might wish to have family member present when receiving medical information. Others might feel more comfortable having procedures performed by healthcare professionals of a specific gender to the religious or cultural reasons, and respecting these preferences of our patient is a way of honoring the patient's dignity. Now let's move to the second principle, the information sharing. So the information sharing to the patients actually needs to be all the time accurate, clear, complete, and honest, and conveyed in a language that it's easy to be understand. Healthcare professionals often use medical jargon that is difficult for the patient to grasp. Consequently, patient may not as if they understand when in reality they do not understand. So we need to try to ensure that the patients truly understand their conditions and the purpose of the procedures and the benefit of the therapy, as well as the potential risk and the plan for the ongoing care. The third principle of patient-centered care is what we call participation. So in participation, we no longer view patient merely as a passive recipient of care, but as individuals with the rights to be involved in every decision regarding their health. For example, patient can express their desired treatment goals, choose a convenient time for health education, or even discuss the more realistic therapy options based on their life circumstances. Now, the very last one, the important one, is about collaboration. So, healthcare is actually the result of cooperation between the patient, their family, and the entire healthcare team. Remember, in the hospital, we cannot work just only nurses, just only doctors, but we work together as a healthcare team. So, collaboration occurs not only between the different healthcare professionals, but also involve the patient as a member of the team, their family as a member of the team, and this leads to more accurate clinical decision, which can improve the adherence to treatment and also reduction in the risk of errors. Let us take a look on the sample, the example that we have from the clinical setting. For example, the principle of respect and how we do it in inpatient ward. So respect will be that we are addressing the patients by their preferred name and maintaining the privacy during the procedures. For information sharing, we can explain the procedures of IV insertion using simple language. For example, we are doing IV on a 3 years old, so we explain about what it will be beneficial for the kid to receive the IV insertion. As well as participation, here we invite the patient to choose a time for education when they are comfortable, so we then can explain the goals of the care when they are at the comfortable time. The next one is actually collaborating. So in collaboration, we involve the patient and the family in developing the discharge plan. So we do. Next, let us discuss the patient-family involvement in patient safety and why do patient and families need to be involved in patient safety. We have long tended to think that patient safety is solely the responsibility of healthcare professional. However, this paradigm has shifted, and today family and patients are viewed as active partners in ensuring patient safety. And why is that? Because no one knows the patient's condition better than the patients themselves and their family. They are much more aware of their medical history, drug allergies, daily habits, and changes in the conditions that may not yet be apparent to healthcare professionals. For instance, a patient might point out an allergy to specific antibiotics, or a family member might mention that the patient typically experiences a drop in consciousness when blood sugar levels are low. This information can be really crucial for preventing errors in care. And by involving patients and family, we are not only enhance patient satisfaction, but also add an extra layer of protections, an additional safety barrier to the patient's safety system. Let's take a look at a few examples of what commonly happen in clinical setting. For example, we have case one. So a nurse is about to administer an antibiotics, and the patient said, "Nurse, I once experienced shortness of breath after receiving this medication." So then we need to help. We need to hold the medication administration temporarily until we verify that the patient is really allergic to this antibiotic. So as a result, we can prevent the medication error and the patient can receive another type of treatment that is then equal with the function of antibiotics. And the case number two is during the patient identification, a family member says, "Excuse me, nurse, but that isn't my father's date of birth." So this identification error can be detected before the procedures take places. And the case number three, if the patient said, "Nurse, I don't quite understand how to use the insulin yet." And then this is a really opening For the nurse to then provide education again using probably the teach back method, so then the patient will be able to teach the nurse about how to use the insulin, so then we can prevent the error of use for insulin at home. In the context, do you think it is acceptable for a patient to speak up if they notice something doesn't seem right? And my answer will be yes, because patients should not only be allowed but also encouraged to voice out your questions and concern. And a culture of patient safety can foster open communications free from fear. So we can then ask the patient and families to be our partners so we can create a safe and quality care, and we believe that they know their condition best and we can do our best to help them to improve the safety and the quality of care. So we involve as a team between patient, nurses, doctor, and family, as well as the whole healthcare system. Now let's talk about the level of patient and family engagement. So the patient engagement does not happen overnight. There are stages that reflect the patient's increasingly significant role in healthcare. Look at them one by one. The first one is inform. So this is the most basic level. The patient receives information regarding their diagnosis, test result, procedures, benefit, risk, treatment plan. However, at this stage, communications is still one way. What is a practical example? A nurse is explaining catheterization insertion procedure to a patient. The second one is to consult. So at this stage, healthcare professionals begin to seek the patient's input. For instance, the nurse asks about the shift complaint, the patient's concern, and or the goal they wish to achieve during treatment. And for practical example, when we are going to insert an IV line, we then ask Mr. Andy, I'm going to insert an IV line to administer medications and fluid. Before we start, have you ever had an IV inserted before? And then the patient probably may answer, yes, nurse, but I'm a bit afraid because it was in the past. I had to be pricked several times. Oh, I understand your concern, Mr. Andy. I'll explain the process first. If it feels very painful and you want me to stop for a moment, just let me know right away. The next one, the level of engagement as family, is what we call involve. So the patient begin to be involved in the care planning process. For example, the patients and nurse determine the most suitable time for a patient education or set the targets for daily activities during the hospital stay. So for application, we have a patient post-operatively who complains of pain and is scheduled for mobilizations exercise. Mr. Andy, once the patient medication kicks in, will be practicing sitting up and walking. Would you comfortable trying this after breakfast or around 10 a.m.? So the key point is that we have the plans, but then the plan is always based on clinical needs, and the patient is given the opportunity to express their readiness and preferences. The next one is collaborate. So in the stage of this collaborate, the relationship evolves into a partnership. The patient, family, and healthcare professionals work together to carry out the care plan. So if a heart failure patient is about to be discharged, the nurse discuss then how it's the home care with the patient and his wife. For example, at home, who usually prepare meals and manages your medication, Mr. Andy? And the wife will probably say, oh, that would be me. And then nurse, all right. So let's put the plan together. You need to know about the medications, fluid insertion, and foods to cut back on. You also need to know when to return to the hospital immediately. Then the family, the patient, the nurse, and healthcare team agreed on this discharge plan that is realistic to implement at home. The point is that the healthcare professional does not merely simply create a plan on their own and hand it to the patient. Instead, the care plan is developed collaboratively. Now, the last one, the important one, is what we call shared decision making. So, this represents the highest level of engagement. The decisions regarding procedures or therapies were made jointly. So, healthcare professionals provide information based on scientific evidence, while the patient shares their values, preferences, goals. The final decision is the result of a discussion and is not an unilateral choice. For example, if a patient is about to go a procedure and see has a very several clinical viable options available, so the doctor needs to explain the benefit and the risks of each option, while the nurse helps to ensure that the patients will understand the information. If there are two opinions, which one is best suited for my condition? The patient might ask like that, and then as doctor, we probably say both options are possible when it but it comes with different benefits and risks. So then as nurses, we can say after that explanation, is there any part that is still unclear to you? So we can go through over it again before you make your decision. The passion then shared the values, concern, preferences, and a decision which reached jointly based on evidence, clinical conditions, and patient preferences. The key point is actually that the patient not merely say yes or to just decide the opinion or the matter according to the healthcare professionals, but actively participates in determining the clinical choice as well. In summary, we can conclude as follows. So we have the principle of patients and family engagement. So I is to inform that I am informed, my family are informed, I consult. I have been asked, and then my family also has been asked. So we have that, and then to involve means that we are in this together, we are included in this plan, and to collaborate means that we plan things together, and when we do decision, we do it together, we decide, we share the decision making process as a group of people. And now, so this is like the meaning in brief for the 5 level of patients and family engagement. The first one is inform, the second one is consult, involve, collaborative, and shared decision making. Next, let's talk about the role of family in patient safety. So as you can see here in the picture, we have the family that following the roles of a primary companion of the patient, provider of information about the patient's condition, and then we have the supporter of treatment as well as the observer of changes in the patient's condition, and we have someone also with high level of health education, and also someone who then will have the partnership with healthcare provider during the care. Now, in the concept of the patient-centered care, the family is not merely there to accompany the patient in the hospital. They are the integral part of the care team, especially when the patient is unstable to articulate their own needs. In Indonesia, many health-related decisions are made in consultancy with the family. Therefore, nurses need to involve the family appropriately, such as during patient assessment, education, discharge planning, or instruction on home medication use. However, it is crucial to remember that family involvement must still keep respecting the patient's right and autonomy. If a patient is capable of making decisions and wishes to maintain their privacy, healthcare professionals must respect that choice in accordance with ethical and legal principles. Thus, family involvement does not mean replacing the patient's voice, but rather providing a form of support that the patient has agreed to. Now let's talk about the practical example. Okay, so a patient has aphasia. The communication has been difficult, so the family help explaining the patient's medical history, drug allergies, and habits. As impact, the assessment become more accurate because and the next patient is we have a heart stroke patient going to be discharged. The nurse educators then provide education not only to the patient but also to the family regarding medication schedules, fruit restriction, low salt diets, and warning signs requiring immediate hospital care. And in this moment, in this case, the impact is then we lower the risk of medication errors and delays in seeking medical help, which then reduced. So the third case is actually an elderly patient that appears sleepier than usual. So the family immediately report these changes to the nurse, and the change in condition is detected early, so we then be allowed to have the prompt evaluations by their healthcare team. Next part, in this classes, we discuss about the patient-centered communication. So why is communications is so important for patient safety? Let's explore this in the following slides. However, in the context of patient safety, communications actually plays much larger role. So it's not when we hear the word communication, it means that we be talking to the patient. So it's much more wider than that just talking to the patient. Imagine a patient receiving instructions on taking medication but not fully understand how to use it. From the administration standpoint, the patient education has been carried out, yet in the practice, the communication has not succeeded because the patient did not grasp the message. Patient-centered communication is not just about providing information. It is about ensuring that the information is understood, relevant to the patient's need, enables the patients to participate in decision making, and having a good relationship between nurse and patients can also build trust. When patients feel heard, valued, they are more likely to be open about their concern, ask questions when something is unclear, or even alert healthcare workers if something seems amiss. All of this contributes to improve patient safety. Now consider this case. The nurse said, take this medication 3 times a day. The patient simply nods, and then the follow-up visit, it is discovered that the patient was taking all 3 tablets at once every morning, thinking 3 times a day meant 3 tablets in a single day. But the communication conveyed the right information. No, this happened because the patient's understanding was not verified. Compare the scenario with a nurse who explains how to use the inhaler and then asks the patient to demonstrate the technique. Did this communication effectively inform the patient? Yes. Error in inhaler technique could be then identified and corrected before the patients went home. So, in your opinion, when can communication with patient be considered successful? Communication is communication is successful not when the nurse finishes speaking, but when the patient truly understands the information and is able to use it for decision making of self-care. Effective communication goes beyond merely conveying information. It assures that information is understood, valued, utilized to support the patient's safety. So we build this mutual respect, the trust, ensure the patient to understand the provided information. We try to reduce misunderstanding as well as we support the shared decision making. And this actually will then prevent the patient's safety incident. The next one is patient-centered communication with various characteristics. We are going to talk about 5 of the characteristics of patient-centered communication. So the first one is what we call listening or active listening. Means that you are giving your fully attention to the patient. It involves not only hearing the words spoken, but also paying attention to the patient's facial expressions, tone of voice, body language, and emotion. For example, when a patient says, "I'm afraid of undergoing surgery," the nurse does not immediately provide the medical explanation, but instead first give the patient space to express their concern. Another characteristic is what we call empathy. So, empathy is the ability to understand that patient is feeling without judgment. So we receive what the patient is feeling without judgment, such as this empathetic statement. "I understand that you're feeling anxious. Many patients feel the same way before surgery. So let's discuss what is worrying you." Empathy can help build trust between the patient and the healthcare professional. The third one is what we call open-ended question, which give the patients the opportunity to explain their condition more fully. For example, do not say, "Has the pain decreased?" but then you can say, "Could you tell me about the pain that you're experiencing today?" Through an open-ended question, we obtain richer information and gain a more complete understanding of the patient's experience. The last but not least is what we call plain language. So use the terms that are easy to be understood. For instance, instead of saying hypertension, we can explain it as high blood pressure. If medical terms must be included, immediately explain the meaning using everyday language. And then the last one is what we call teach back. So after providing education, do not simply ask, "Do you understand?" But then almost all patients will say yes. Instead, use the teach back technique, for example. "To ensure my explanation was clear, could you explain back to me how you will take this medication at home?" And this method allows us to determine whether the patient truly understands the information provided or not. And the patient's communication is a two-way process that fosters understanding, trust, partnership among the patient, their family, and their healthcare provider. So remember this characteristic. We have active listening, empathy, open-ended question with the plain language, and we try to do the method of teach back. Next, the barriers and the strategy to overcome the problem in communication as patient-centered communication. So an effective communication is not always easy to achieve, and we must recognize various barriers to ensure that the messages they convey are truly understood by the patient. Let us discuss some commonly encountered barriers. For example, we use the medical terminology. Healthcare professionals use the terms such as hypertension, dyslipidemia, myocardial infarction, or pulmonary edema without explaining their meanings. While these terms are commonplace for healthcare professionals, they can be very confusing for patients. Therefore, use simple language and explain medical terms in they must be used. The second one, to overcome the barrier of limited time for care. In hospital, nurses often face with heavy workload, leaving limited item, limited time for patient education. However, brief communication can still be effective in its focuses on the most critical information and employs techniques like the teach back method to verify patient understanding. Another one is to learn from the patient's emotional state. So patients who have just received a diagnosis of serious illness may feel afraid, sad, or angry. In such states, the ability to process information is often diminished. So nurses need to demonstrate empathy and choose the right moment to provide education. Another one is what we call cultural linguistic differences. So in Indonesia is characterized by culture and linguistic diversity. A person's understanding of illness, acceptance of the medical procedures or decision making can be influenced by their cultural values and beliefs. Consequently, communication should be tailored to the patient's background without comparison patient safety principles. The last one is sensory impairment. So elder patients may experience hearing or visual impairment. In such situation, nurses can speak more dearly and use large print materials or even involve the family member to assist. If you encounter this barrier in low health literacy, so please, not all the patients possess the same ability to comprehend health information. So nurses need to adjust their explanations and confirm that the patient's understanding before concluding the educational session. So here, the strategies: you use plain language, you give parents the opportunity to ask questions, and use the educational material, and then involve the family member, as well as apply the teach back technique, and to um, adapt in communications to the patient's cultures and condition. Now, how do we implementing the patient's centered care in nursing practice? So we do assessment, we provide education, but not limited it only through the education itself, but we evolving the apply assessment, diagnosis, planning, implementation, and evaluation. So in assessment, we probably would be able to then collect the clinical data and also to seek the understanding of the patients as an individual. And beyond um, inquiring about the chief complaints, we need to identify the parents' values and beliefs, their cultural background, family support system, the goals of the patient wishes to achieve, and the patient concerns or expectation regarding their care. This information enables nurses to provide care that is better aligned with the patient's specific need. The second one, after we do the assessment, we do what we call the nursing diagnosis. So here, this is not just merely based on the objective data, but they also can take the patient personal experiences into account. For instances, two parties with the same medical diagnosis may have different priority concern. One patient might be primarily worried about pain, with the other is more anxious about being able to work. After that, we move on to the third stage, which is planning. So here, we then involve the patient and their family to set the goal for the care. Example, patient is able to mobilize. So instead of writing that, we can ask what the goal would you like to achieve before being discharged, and this makes the goals more meaningful to the patient. Another implementation is that we deliver the nursing care as usual. So the nurse explains procedures, obtain the patient's consent and if necessary, um, invite questions, and involve the family in education and care activities. Implementation focuses not only on physical intervention but also on therapeutic communications and patient empowerment. The last part of the nursing practice is the evaluation, where in evaluation we are not only checking the clinical goals, but we also met there for the patient's experience. For example, in addition to evaluating a reduction in pain level, the nurse might ask, do you feel that the care goals we agreed upon have been achieved? And this approach helps nurses to then able to provide the care that is truly patient-centered. Now, how this principle being applied in daily practice. So the example is upon admission, where we then not merely conduct physical assessment but also introduce themselves, explaining the care environment, and explore the patient's expectations and needs. A simple act of introducing oneself can foster a sense of safety and build patient trust. And during the medical administration, before we administer the medication, the nurse will explain the drug's name, its purpose, how to use it, and any side effects to watch out for. The nurse then ensures the patient understands this information, and this approach is better prepares to the patient for then their continuations of their therapy independently after discharge. Another one is when we apply this or implement this during the procedures, for example, an IV line. So because of the procedures, the nurse can explain the process, its benefits, and any potential discomfort that patient might experiences. The nurse also respects the patient's privacy and provides opportunity for questions, as well as then we provide the procedures with an effective communication enhanced to patient trust. And during the patient education, education involves more than just explaining information. The nurse must ensure the patient truly understands it, and often by using the teach back technique. For example, would you explain to me how to use this inhaler at home? And during the discharge planning, as the prime example of patient-centered care, the nurse collaborates with the patient and their family to create a discharge plan covering medication schedules, dietary guidelines, and recommended activities, follow-up appointments, and warning signs that require immediate attention. This also equips the patient to continue their care independently at home. So we continue to perform it through all the process of nursing care plan that then we will be able to see the next one. Now, the final topic of this class is actually about cultural diversity. So as you know, Indonesia is a highly diverse country, and we have hundreds of ethnic groups and regional languages and religious and also distinct values. These differences influence not only daily life but also how individuals perceive health and illnesses. For instance, some patients wish to be accompanied by family member when receiving medical information, and other prioritize religious consideration before consenting to procedures. And some patients feel more comfortable using their regional language when receiving health education. As nurses, we are not expected to be familiar with every existing culture. However, we do need to possess cultural sensitivity, the ability to respect and adapt care to the patient's background without compromising to the quality or safety of the care. That is a tangible example of patient-centered care. For example, a female patient is due to have urinary catheter inserted. To say if it's possible, I would feel more comfortable having a female nurse perform the procedures. How should the nurse respond? Should they refuse because all patients treated equally, or should then explain the surface condition and provide it does not compromise safety or operation, so we can accommodate the patient's preferences, or we then ignore the patient's request? I think the choices B. Why? Because respecting patient preferences is a part of upholding dignity and respect, provided it does not compromise the patient's safety and service policy. Another example is an elderly patient who do not understand Indonesian well. So what can we do? Involve family member to assist with communication while maintaining confidentiality, as well as obtaining the patient's consent if necessary, or use an interpreter if available. Or another example regarding food, that if a patient have a dietary restriction based on religion or culture, we do collaborate with the nutritionist to find the dietary alternatives that meet nutritional needs and are safe for the patient's medical condition. Another example regarding decision making, in some families, healthcare decisions are discussed collectively. What can we do to our patient? We involve the family according to the patient's wishes, while still respecting the patient's right to make their own choices if they are capable of doing so. Now, regarding this, must every patient request be granted in the name of respecting culture? The answer is no, because nurses need to strike a balance between respecting culture, ethical principle, patient safety, scientific evidence, and hospital policy. Respecting a patient's culture does not mean disregarding patient safety. Patient-centered care is the effort to tailor services to the patient's values and preferences without compromising the quality of care. Now, so what strategies can nurses employ to provide culturally sensitive care? In conclusion, I want to emphasize that culturally sensitive care does not mean we must memorize every culture present in Indonesia. What matters most is maintaining a professional attitude that recognizes each patient as a unique individual. There are 5 simple steps as nurse that we can take. The first one is recognize the patient as individual. So we do not assume that all patients from a specific ethnic group or religion share the same needs. The best approach is to politely ask about the patient's preferences and habits regarding their care. The second, we do active listening. So we give the patient space to express what is important to them. By listening, we can gain a more complete understanding of the patient's need. Third, adapt your communication. Choose language that is easy to understand. If there are language barriers, utilize assistance from family member or interpreter in accordance with hospital policy while ensuring patient confidentiality is maintained. Fourth, involve the patient and the family. Invite the patient to discuss treatment option and involve the family if the family wishes or if the patient's wishes and conditions require family support. Fifth, we prioritize patient safety. So respect culture does not mean that we disregarding safety principle. In a cultural practice possessed of potential risk to the patient, the nurse needs to provide clear education, discuss the matter with the patient and family, and seek a solution acceptable to all parties without compromising safely. For example, if the patient with diabetes wants to stop taking insulin because they believe traditional medicine alone is sufficient, as a nurse, what should you do? We do not immediately forbid the patient. We do not ignore the patient wishes, but we then explore the reason, respect their belief, provide evidence-based education regarding the benefit and risks of therapy, and then discuss the best option with the patients and family and healthcare member. Patient-centered care goes beyond merely focusing on the disease, but it focuses on the person experiencing the illness. Therefore, self-care is care that respects the patient's values, needs, preferences, and cultures through communication, collaborations, and evidence-based practices. Before we conclude today's lecture, I would like you to keep the 6 key points in mind. First, patient-centered care does not mean the patient is always right. Rather, it means treating the patients as partner whose right values, preferences must be respected. Second, patient safety is not solely the responsibility of healthcare professionals. Patients and their family also play a vital role in preventing care-related errors. Third, communication is the primary bridge for building partnership. Without effective communication, it is difficult for patients to understand their condition or to participate in decision making. Fourth, patient-centered care is not an optional add-on. This approach must be applied at every stage of nursing process from assessment to evaluation. And the fifth, every patient has a unique cultural background, set of values and beliefs. Nurses must respect these differences while continuing to prioritize patient safety. And finally, the ultimate goal of all the concepts we have studied today is to provide care that is safe, high quality, and aligned with the patient's needs. Now, Let's return to the previous case. Mr. Andy, 65 years old, was hospitalized for heart failure. During the hospitalization, the nurse explained the treatment using medical terminologies. The patient simply nodded, never asked questions. The family was not involved in patient education. Upon discharge, the patient only received medical prescription without any explanation regarding diet, fluid restriction, physical activity, and warning signs. 4 days later, the patient returned to emergency department with worsening short of breath. So let's discuss this. Which principle of patient-centered care was not applied? How should the nurse have communicated? What is the role of the family in this case? And how should the discharge planning process have been conducted? If the patient has a habit of consuming household food due to family culture, what approach could the nurse take? So please answer this on your forum. So I'll see you again on our next class. Thank you for listening today. Have a pleasant time of studying. Here are the references list. Thank you.